So the question is, I have lived with my dentures for years. Is it necessary to switch over to implants, or can I continue with my dentures? So this is one of the common things that I see in my office. Patients sometimes come to me with absolutely no bone at all, and they are wanting some implants because, as you might know, for patients who have dentures, the dentures are not the most comfortable thing, particularly the regular dentures. This is what I'm talking about. I always tell them the dentures are like flip-flop and they don't stay around, and that's the reason why we recommend you get implants, and the implants kind of snap in just like that. Not only that we recommend you place the implants to snap in your denture, but also to retain the bone. Like I said, if you don't have the implants, over a period of time, the bone underneath the denture, it starts to deteriorate over a period of time. So if you're, let's say for example, if you were 30 or 40 years old and you got a denture at 30 or 40 years old, and you lived along with the denture for 20 years, and now you got possibly some decent bone remaining for us to be able to place the implants. Let's say you continue to wear the dentures for another 20, 30 years, and then now you're about 60, 70 years old. Now your denture absolutely does not stay at all in your mouth. Now you're wanting to get some implant. At that time, you may not have enough bone at all to be placed, to have some implants placed. So depending on the type of bone, and if you have good bone, can you get by for a number of years, 20, 30 years, without the dental implants? The answer could be yes, but more and more patients that we see here, many number of patients that we see here in our office, they require some type of bone grafting if they have lived with the denture long enough. So we always recommend not taking any chances. If you are able to fit the implants into your budget, I always recommend get the implants as early as you can. That way you can continue to stay looking young, and that way you can prevent the bone loss, and also you don't have to ever worry about not having to have the problem of not being able to get implants at all because you don't have any bone. So it's always prevention is better than cure. That's my recommendation.